Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Fashion really does play a role in your health. The physical and mental health is so tied together. You want to feel good in what you're wearing. When you're already feeling so bad about living in pain, it really does make a difference to look good and feel good, as they say.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. But before we get started, we want to be sure that everyone takes a listen to all of GHLF's brilliant podcasts. We have so many to choose from.
We sure do, and as a reminder, you can check them all out at ghlf.org/listen. This week, we'll give a shout out to Healthcare Matters, hosted by our colleagues Robert Popovian and Connor Mertens. They do a deeper dive on policy issues, and season 3 is coming soon, so definitely get caught up on season 2.
I call Robert and Connor the smart guys because they seem to know it all when it comes to health policy matters. So definitely check it out.
Let's start with a listener comment. Are you ready?
Let's do that.
Okay, this one is from Nick P., who wrote, "Great podcast with timely topics." Steven, this week we have a special guest interview, and I'm really excited for you to hear it. I spoke with LGBTQ advocate Kelly Cusack, who on September 8th, she'll role in a first-of-its-kind runway show preceding New York Fashion Week.
Wait, what do you mean role?
So Kelly lives with spinal muscular atrophy and uses a wheelchair, so she will be taking part of this show called Double Take, which is a fashion show aimed at increasing disability visibility and break down stereotypes around fashion. So to really showcase adaptive fashion, Kelly and other people living with disabilities will be participating in the show.
Oh, sounds exciting.
Yeah, it's really exciting. And she came on to speak to me about her condition and for her hopes about what people will learn from this fashion show.
Excellent. Well, I can't wait to listen.
As we always do, we have a few news updates before we hear the interview.
Well, we had another COVID-19 patient support program quick poll. We asked our community what our folks think about the new CDC guidelines and what their plans are now.
Surprisingly, 95% of the people that had answered, and as a reminder, these are people living with chronic illness, said they had not heard about the latest CDC COVID guidance before our poll came out.
70% said they feel unsafe due to the less restrictive guidance, and 27% said they feel the same.
About half of respondents from the poll said they'll continue going out in public the same amount, and the other half said they'll go out less often. In the free response section, it became clear that people who are going out the same amount are still following the traditional COVID safety precautions like masking, social distancing, and hand washing.
I definitely get the sense that the number of mask wearers is really dipping, almost falling off a cliff. Anecdotal, this is not a poll, but New York City public transit, where it's technically still required, my gut is it's down to about 15%. Whereas at the beginning of the summer, I felt it was well north of 50%.
Here in Nashville, Tennessee, it seems like I'm one of the only ones wearing a mask. By the way, in the free response section of the poll, many people highlighted how a mask would just make them feel so much more safe.
I continue to wear my mask, and I have to be completely honest about it. I do feel like a big reason I wear the mask is less for personal protection at this point and more to make it as socially acceptable as possible to continue wearing masks.
I don't think you need a reason. It feels good. When I see somebody else with a mask, it's almost like we have a little wink at each other, like, oh yeah, you too. Awesome.
That's true. And as I said many times, it's not just COVID. I don't want to get the flu. I don't want to get, heck, I don't even want to get a cold if I can avoid it.
Especially when you have chronic illness, like any little ailment, it's not exaggerating when you say it really does have an impact. I live with arthritis and Crohn's, and if I even have a little cold, I feel it in my gut, I feel it in my joints. It's an all over really bad feeling. And then sometimes you have to pause your medication, so then your chronic illness acts up. It takes you for a loop. Our next piece of news, there was a new study published, and it was about support and needs in the workplace for chronic illness. So let's go through some of the results and then talk about what people can do. The study was published in Arthritis Care and Research. It actually focused on Canadian rheumatic disease patients between the ages of 18 and 35. So what they wanted to do was learn more about how telling a supervisor about a rheumatic disease might impact the level of workplace support. Interesting question.
So what did they find?
So they found that 70% of young adults told their immediate supervisor about their condition, which I was surprised. Working in a healthcare organization, I feel more comfortable to talk about my chronic illness, on the podcast with you and at work in general. But it's interesting when we work at a place where people understand and we're working with patients all the time. So there's like a natural way to bring it up. I was surprised for the people who don't. It must be really challenging to do so.
I think similarly to the 70% of young adults, I was more inclined to tell my immediate supervisor, but not go beyond that.
Right.
First of all, I had to go get infusions, and that requires a lot of time away from the office. So I felt I had to say something. It would have been awkward for me to not say something.
Yeah. Here's what else the survey found. They measured presenteeism, which is the concept of showing up for work but not being productive. I think we've all found ourselves there, chronic illness or not. And they found that presenteeism was high, especially when workplace supports needs were not met. And the opposite was true too, so that when the supervisor and organization met the needs of the employee, presenteeism was lower.
It's a different feeling when you feel as if you and your work product is valued versus your body being present at a certain place is the value.
So here was some of the most wished for workplace supports. Number 1, a flexible work schedule.
Yeah.
2, prescription drug coverage. 3, extended health benefits. 4, paid sick leave. 5, modified job duties, and 6, an ergonomic and accessible workstation. As advocates, what can you do if you find yourself in a situation where you're at work and you need some of these things and don't know what to do?
I think it's important to remind everyone to advocate for yourself in the workplace. If you don't feel comfortable talking to your supervisor, talk to someone perhaps in your human resources department and ask for the company's disability plan and insurance policy. And of course, know your rights. There is the Family Medical Leave Act, FMLA, that allows you to take up to 12 weeks a year for medical emergencies, and the Americans with Disabilities Act, which requires employers to make reasonable accommodations for disabled workers.
All great reminders. Thank you for that. I think it's important to remember that advocacy can mean talking to your legislators, but it can just mean, sticking up for yourself in everyday life and getting your basic needs met.
When you're standing up for yourself, you're also standing up for others, because the more you normalize what it is to have a chronic condition, the more you show that as a member of the chronically ill community, you're still a productive member of the workforce. The more folks that see that, the more you're actually helping others.
Amen. Well said.
In other news, Texas has confirmed the first U.S. death of an individual who had monkeypox. It's not yet known whether the individual died from monkeypox, but what we do know is that the patient was severely immunocompromised.
When I saw this headline, I got nervous because, we know our community is at high risk for a variety of illnesses. And this was the first death publicly reported by health authorities during this current monkeypox outbreak. So I think what you said is true. It's too soon to know if it was monkeypox. We're waiting for autopsy results. And instead of being scared, we have to figure out, what can we do in the meantime? What could we do to stay safe? And I think it goes back to what we always talk about, make a plan.
Always talk to your doctor. Don't be scared, but there are scary things out there.
Yeah.
But talk to your doctor to help navigate the world.
Sometimes headlines are put in a way to make it sound scary, so take it with a grain of salt and know that you have a community here with us, and we'll continue putting out information on monkeypox and what you need to know. Well, Steven and our listeners, have you ever wondered what it's like to be in a fashion show that's focused on people with disabilities? Well, the good news is that disability representation in the fashion industry has a long history with rheumatoid arthritis designer Michael Kaluva. He's championed this issue for years, actually. Kaluva designs accessible clothing, raises awareness for chronic illness through fashion, and features patient advocates like Kelly Boyd as models in his New York Fashion Week Tumbler and Tipsy shows. Now we meet Kelly Cusack, who lives with spinal muscular atrophy and will be featured in a fashion show as she rolls down the runway at New York Fashion Week on September 8th. Let's press play on this interview and learn more from Kelly about how she advocates for the disability community and increases awareness of adaptive fashion. Welcome, Kelly.
Hi, thank you for having me.
Of course, tell us a little bit about your story and what it's like living with SMA.
Yeah, sure. So I'm Kelly. I'm 23 and I have SMA type 2. For me, that means I have a wheelchair. Living with SMA definitely isn't easy, but I'm so grateful for my community and people and friendships that make it worthwhile.
So tell us about the community. How did you become an advocate and start sharing your story and connecting with the community?
I started doing fundraisers with my mom and a bunch of my middle school friends when I was around 10 years old. And ever since then, I've just been really involved. My mom and I became co-chairs for the North Jersey chapter of Cure SMA, and we've been doing so many amazing things since then. And the conference has really helped me find my community and find my people and feel better about my disease when it's really hard, when I have hard days.
For sure, having a community is so special. Just that feeling of when you know someone gets it on some level and can connect with you. It definitely inspires in me to share my story when I'm talking with people that get it. You mentioned you've done some stuff over the years. Is there like an event or a day that stands out to you?
Oh, there's so many. I love all the bake sales that we did, and then we did the bowl-a-thon where we partnered with a local bowling alley, and all the fundraiser money went towards SMA, and that was so much fun. We had pizza, we had all kinds of different foods, and everyone just had a great time.
I think it's so great to have fun while you're doing important work. We're really here today to talk about this upcoming fashion show. Tell me about this show that you're taking part of. It's coming up preceding New York Fashion Week.
Yeah, so it's called Double Take, and basically the whole concept is that it's all about disability representation and advocacy, and also the SMA community, and just finding representation in that, because we kind of feel like it's hard to find things that are fashionable for us. I know for me personally, and a lot of my other friends, we shop in kids' clothes and kids' sizing, and it's hard to be inclusive and accessible that way. So this show is kind of to us in the community. I'm so excited.
And how did you get connected with the show?
James Ian's music video spaces I saw online, and I just loved it so much. I posted about it online, and then someone from his team reached out to me and said, hey, we saw how much you love his project. We want to do something similar. Would you like to be involved? And I was like, absolutely, yeah. That sounds like so much fun.
The show aims to increase disability visibility, break down stereotypes, and really focus on adaptive fashion. What does this mean to you? And what kinds of changes would you like to see in fashion?
For me personally, I feel like price points, for me, I feel like needs to be changed, but it's just not accessible enough, if that makes sense. So for me in the future, I just hope that it would be more affordable and just easier to get access to.
There's so much that goes into caring for your health, and I think people just think of it as between you and the doctor, but it's actually so much more than that. And fashion really does play a role in your health, and the physical and mental health is so tied together. You want to feel good in what you're wearing when you're already feeling so bad about, living in pain or whatever it is. It really does make a difference to look good and feel good, as they say.
Yeah, definitely. I get in my head a lot sometimes about what's going on with my SMA. So an outfit just really changes my perspective and just gets me out of that. It makes me feel so much better.
Me too. I am with you. An outfit can turn around my day. When others see this show, what do you hope that they'll learn and take away from it?
I hope people see us for who we are, now that we're human, and just get to see the disability community in a different light, and just know how powerful that is, that representation, and how important it is for sure.
I think that's such a good point about, seeing disability people in a different light. We can participate in society like everybody else and have fun and be beautiful and be showcased in a fashion show. And I think it's so amazing that something like New York Fashion Week, which is so big, that we're able to be part of it. So thank you for all that you do. Do you have your outfit picked out?
I can't say much about it, but yeah, I have my outfit picked out. I'm so excited.
What is your advice for other people out there looking to raise their voice and just don't really know how to get started?
I would say just get involved locally or whatever disease you may have, disability, whatever you may have, like look online, all these different organizations, and just see how you can get involved. I feel like everybody has a different chapter of organizations nearby, and you never know, or even just connect with people online and be like, hey, I have this. What resources do you use? That's really helped me become more out there.
Well, speaking of getting involved and finding your community, how can our listeners find you and stay in touch with you?
So I have a blog for thewildwarrior.wordpress.com, I think it is, and my Instagram, which is at KELLIELYNNE99.
Awesome. Well, thank you so much, Kelly, for sharing your story with us and our listeners, and we're excited to see you in the fashion show.
Thank you for everything, Zoe. I really appreciate it.
Thank you to Kelly for sharing with us and our listeners. We hope that the fashion show goes really great. If you're interested in seeing Kelly roll the runway and other disability advocates as well, we've put a link to the fashion show in our show notes, so definitely check it out. I encourage you to watch it on September 8th. That brings us to the close of our show. Steven, what'd you learn today?
Well, I learned from our discussion the term presenteeism. I'm guessing it's a new term because I had not heard it before. And I learned that's the idea of when you're at work and physically present, but not altogether working too hard.
And going off of that, I learned as a reminder about the importance of knowing your rights in the workplace.
Well, we hope that you learned something too. We'd love to hear from you about your advocacy stories. Send your email to thehealthadvocates@ghlf.org, or better yet, include a short video or audio clip.
And who knows, whatever you share may be included in our listener feedback portion of future episodes.
Also, email us if you want to subscribe to our weekly newsletter, where we share the top health news of the week.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating and write a review on Apple Podcasts. And definitely hit that subscribe button wherever you listen so you never miss an episode. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.